Michael Bragi. I'm one of the foot and ankle attendings at Harborview Medical Center. So I have a predominantly elective foot and ankle practice, and I basically am heavy into ankle and hindfoot procedures. I do some forefoot. I actually will do anything. I've also been in private practice in my career, so I have a pretty good handle on forefoot, midfoot, hindfoot, and ankle procedures. But here at Harborview, since we're a tertiary care center, we seem to really get more of the complicated ankle and hindfoot stuff. It's one-on-one a lot of times in surgery and in clinic. I also do have residents on my service to also instruct and help. So we're a foot and ankle team of residents, fellows, and myself.
My experience is a little bit unique just because I have a family member. My mom works down in the OR for orthopedics, and so I like to think that I kind of get a different perspective on our docs and just on the services, just because I get to hear what her experience is like down there. I think it's fun for me because I get to kind of see all of our doctors at their best and kind of see their personalities and kind of when they're away from the OR, because the OR can be stressful. But I think it kind of, I don't know, for them, I think it's easier because they trust that, I'm going to take care of them and take care of them up here administratively. And then my mom will be able to take care of them down in the OR, which I think is great. So foot and ankle, we have 4 wonderful faculty members: Dr. Bragi, Dr. Sanjorzen, Dr. Benershka, who is fabulous as well, and Dr. Chin, who is relatively new. He's up at UW Medical Center Northwest. And it's been great because he does a lot of sports. We do sports here at Harborview as well, but that's kind of his main focus. And so he's able to kind of show our fellows kind of a lot of those different cases and give them experience with that, which they might not necessarily have received here at Harborview. But these are some of the best foot and ankle surgeons in the country. And, when you come here, you'll learn so much about foot and ankle surgery, reconstruction, all that kind of stuff.
So a fellow with me in the OR can expect a lot of hands-on action with a lot of sports cases and fracture cases. My practice is a lot of sports injuries and sports reconstructions, as well as trauma, acute trauma. So a lot of ankle fractures, ankle arthroscopy, lateral ligament reconstruction. So I think that's been an area that this program hasn't had a whole lot of, so I'm hoping to bring that to the program.
It's our hope that you'll learn the basic principles of foot and ankle care and surgery. We think that while you might not get to see some of the more routine common problems, such as a Morton's neuroma, we feel that with the amount of surgery and complexity that you'll see, that it will really be no problem for you to do those kind of cases. So we do think that you'll really be ready for the complicated, deformed, and advanced arthritic foot and ankle conditions that you'll see.
So our patient population at University of Washington and Northwest Hospital really varies, like a lot of foot and ankle pathology, which is what draws a lot of surgeons to the practice of foot and ankle. So I think my practice leans heavily towards young athletic patients who want to get back to high-level activities.
So because we take cases from the WWAMI region, Washington, Wyoming, Alaska, Montana, Idaho, it's about 25% of the landmass of the U.S., where the cases have stayed the same. The case volumes have stayed the same. Trauma is awesome. I just love to talk about them because they do such great work. I mean, if you break a bone and it's a traumatic injury within the WWAMI region, so Washington, Wyoming, Montana, Idaho, Alaska, you're going to come to Harborview and you're going to have the best care that you could possibly get. Our trauma surgeons are some of the best in the world, and Harborview is known for orthopedic trauma. And so that makes it fun to have fellows come here and really learn how we do orthopedic trauma surgery here, because they've literally learned from the best people in the country. And that makes my job fun because people want to come here and they want to learn, and it's so special.
Well, I really think that we have a really good trauma experience. So if you feel like you have a significant deficit in complicated foot and ankle trauma, we really have that covered. Dr. Benershka's practice, while has some elective, he still does a great majority of foot and ankle trauma cases. He's an absolute master at it. Dr. Sanjorsen also has had many years of trauma and still gets a pretty good referral source for foot and ankle trauma cases as well. So we have trauma really covered. We also have total ankles and revision total ankles that I don't think that many other programs can boast about. And we see a fair amount of complicated post-traumatic deformity and shuffle reconstructions. We have a Monday conference every Monday. We discuss the week's cases from the week prior. We also intersperse didactic lectures. We try to invite previous fellows and residents who are now in foot and ankle to also provide us a talk now that we're doing everything via Zoom. We also have didactic lectures from our own faculty. We have journal clubs every 6 weeks as well. And so we feel that is a pretty good program. So Dr. Sanjorsen has an extensive research facility at the VA as well, and believe that he has a huge database of foot and ankle patients that can be reviewed. He has gait labs and cadaver labs there, so all that research facility is available.
And so I am one of the newest faculty to the department. I've been here about a year and a half. And so I have somewhat of a different experience. Being a recent fellowship graduate, I have a slightly different perspective than the other attendings. So I'm pretty involved with education, and I think I'm relatively down to earth. So I hope that we can build a good friendship as well as a good teaching relationship. And I think our program has some unique features to it. So it's obviously very Harborview heavy. There's a lot of trauma, post-traumatic deformity, reconstruction with ankle replacement, and a lot of complex stuff. I'm hoping to bring more of a bread and butter feel as well as a lot more sports-focused practice to the program.
Yeah, I mean, the winter months are gray, and it can be tough for some people that haven't kind of experienced it before, but it's not as rainy as you would think. I mean, of course, they portray Seattle as like this super rainy city where you can't do anything, you have to have an umbrella all the time, but really it's not bad. You can still go hiking, you can still go outside, you can go to restaurants. There's a lot of great restaurants around Seattle. Of course, with COVID, it makes it a little more difficult, but a lot of restaurants are still doing takeout, and you kind of get your warm jacket or your rain jacket and you just go out and do stuff, and it doesn't really bother people, I guess. I don't know.
So I'm an outdoors kind of guy, so I love the hiking. You have more than 7,000 hiking trails in the state alone to explore. I also like to ski in the winter. There's 3 ski resorts in the area that provide more than enough skiing. If you're into water sports, we have that too. We have a lot of lakes, and we have the Puget Sound, where I've seen people water ski and waterboard and all that as well. So all of that outdoor recreation stuff is here. Once the COVID crisis is over, I hope all the restaurants will come back, because we did have a nice restaurant, diverse. We had a lot of diverse restaurants to go to. Hopefully that'll all come back once the pandemic is over.
In Seattle. Seattle's been great. My wife is from here, which is how we ended up here. But since being here about a year and a half, things have been great. I think it's a really fun place to live. If you have a family, it's really fun to raise children here. We're really close to the mountains and really close to the beach. So on a summer day, I can mountain bike in the morning and go to the beach in the afternoon. And so I don't think that can't be beat.
We have a really unique, extensive alumni network. You can join an email list server, and on that server, foot and ankle physicians from all over the world can post their challenging cases, and you can receive criticism and feedback from your colleagues all over the world who have either trained here at the Harborview or are fellows of fellows who have trained here. So it's really a wonderful experience and a good resource.
I would say things are pretty much the same. The only difference, I guess, would be for me. I work from home, and that's different than what I did previously. In all honesty, I don't like it, because I like coming in and seeing all of you guys, all the fellows, and seeing all of the doctors and getting to hang out with them and talk to them, because they're just great. I think for you, for fellows, it's the same. You're still going to see all the cases that you would see normally. It's kind of business as usual here. You'll just have to wear a mask. You'll have to wear your eyeglasses. There's different protocols in place. But otherwise, it's still the same. It's going to be the same.
So after rotating with me, the fellows should be very comfortable with straightforward arthroscopy, anterior arthroscopy, posterior arthroscopy, subtalar scopes, ligament reconstruction, and also being able to deal with patients and getting them back to their goals and getting them back to athletics.
As far as I know, employment and job opportunities are really still very strong. And just last year, we had one of our fellows return to academics to the program that she trained, and 2 others went into private practice. But their jobs are still plenty available, and I don't know of anyone who really couldn't get the job that they wanted.
If after viewing this video and you've made it to the end, yay, you're still interested in our fellowship programs, you can apply through SF Match. That's where we get candidate information and we pick our candidates to be interviewed. All of the applications are viewed with great care, and our doctors take a lot of time to go through them and see who might be a best fit. We look forward to having you apply and hopefully meeting you via Zoom this year, and see if you'd be a good fit for our programs.
Finding something that's a really good fit for you, both on a personal level and an academic level. Find something where you really gel with the attendings as well as the current fellows, and make sure that this is something you want to do for a year, because this experience is something you're going to carry through the rest of your life and your career.
We're real user-friendly. Ask us anything. We don't really think any question is too silly or stupid, and we hope you will come here.